The topic of my today's video portfolio is at-home rehabilitation for anterior cruciate ligament injuries, heel slide exercises. Ligaments are thick bands of tissue that connect your bones. The anterior cruciate ligament, or ACL, is a ligament in the middle of the knee. The ACL prevents the shin bone from sliding out in front of the thigh bone. An ACL injury is caused by overstretching or tearing of this ligament. The tear may be either partial or complete. An injury to the ACL affects the stability of your knee. This can result in loss of leg strength and a restriction in the knee's range of motion. The at-home exercises can help you recover from an ACL injury. Doing this exercise can help you regain strength and movement without causing further injury to the ACL. These exercises can be done at home, ideally with the input of your doctor or physical therapist. They can help prepare you for ACL surgery or complement your structured rehabilitation program. There are 3 of the best and safest exercises for an ACL injury. Do this exercise early on when your knee is still fragile. The exercises are heel slides, isometric quad contractions, prone knee flexion. Heel slides are simple leg exercises that involve extending your leg away from your body, bending your knee, and sliding your heel toward your buttocks. You can do heel slides using a bed, floor, or wall. They are often recommended after having a knee surgery or typical knee injury. You can also use heel slides to prevent and treat low back pain. The purpose of heel slides is to increase the range of motion of your knee. They also help to strengthen and stretch the tissues around the knee and leg muscles. This is an essential part of the recovery process and helps to prevent further injuries. The FITT principles are exercise prescriptions to help participants understand how long and how hard they should exercise. FITT is an acronym that stands for frequency, intensity, time, and type. FITT can be applied to exercise in general or specific components of exercise. FITT principle regarding heel slides: frequency at least 2 times per day, intensity low or moderate intensity, time for each exercise do 1 to 3 sets of 10 repetitions, rest for up to 1 minute between sets. And type of exercises are strength training.
First, identify your ASIS and tighten your core. Continue by pulling your heel to approximately 90 degrees towards the rest of your body, then return your leg to an extended position. You may release the tension in your core before tightening again and bringing your opposite foot toward your body and repeating the process. 1 repetition includes pulling each heel towards your body 1 time. Complete 3 sets of 10 to 15 repetitions. Between each repetition, you may relax your core, making sure that you're breathing each time. If this is uncomfortable and you are only able to move your heel a certain distance before discomfort, stay in the range that is most comfortable for you but is still challenging.
There are several heel slide exercises to try. You can do 1 or more depending on your needs. Each variation will target slightly different muscles. Variations of the exercise: heel slides lying down, abduction and adduction heel slides, seated heel slides, chair heel slides, and wall heel slides. Heel slides lying down. You can experiment with your toe placement. Point your toe or draw your toes back toward your shin, or turn your toes to either side. Lie on your back with your legs extended and your feet slightly apart. Slide your affected leg as close to your buttocks as you can, and hold this position for 5 seconds. Slide your heel back to the starting position.
Lie on your back with your legs straight. Bend your symptomatic leg as far as you can, sliding your heel towards your buttocks, keeping the knee pointing to the ceiling throughout this movement. Slide the heel back down, reversing the movement until your leg is straight again.
Abduction and adduction heel slides. For this exercise, maintain your hip and leg alignment by keeping your knee and foot pointing toward the ceiling. Lie on your back with your legs extended and your feet slightly apart. Point your toes or draw them back toward your shin. Slowly slide your affected leg out to the side. Slide your leg back to the starting position without bringing it past the midline of your body. Seated heel slides. Sit on the floor with your legs extended in front of you. Keep your foot flexed as you slide your affected heel along the floor towards your buttocks. Hold for 5 to 10 seconds. Slide your heel back to the starting position. Chair heel slides. If possible, use a chair with armrests. Press your thighs firmly into the chair throughout the exercise. Initially, sit on a chair with your legs extended. Slide your heel back as close to the chair as possible. Hold for 5 seconds. Slide your foot back to the starting position. Wall heel slides. If you need additional support for this exercise, you can also hook your unaffected foot and your opposite foot as you slide your heel down the wall. Lie on your back with your hips a few inches away from the wall. Bend your unaffected leg and place the sole of your foot against the wall. Extend your affected leg with your heel against the wall. Slowly bend your knee and slide your heel down as far as possible. Hold this position for 5 seconds. Then place your unaffected foot under your opposite foot to assist in lifting your foot back to the starting position. Lower your unaffected foot back to its starting position. There are several errors in the techniques. Instead of starting immediately doing this exercise, you should warm up for at least 5 minutes. Instead of doing fast, jerky movements, you should do slow, controlled movements. And instead of arching your neck, you should engage your core muscles. Heel slides build strength in the quadriceps, hamstring, and calves. They also work the muscles and tissues around the knee. Heel slides strengthen the core muscles, which helps to prevent and treat low back pain. Strong abdominal muscles also help to improve overall stability in your body, which helps with all movements. Benefits of the heel slides. Heel slides are usually used to rehabilitate the body following surgery or injury. They are a simple way to keep your body active, especially if you are not fully mobile. Heel slide increases the range of motion your knee, which helps to improve mobility, flexion, and flexibility. They also help to strengthen your hip and leg muscles, ligaments, and tendons. Plus, keeping your leg active with heel slides relieves pain and boosts circulation, which allows you to feel better overall.